As I've reflected on many conversations like this with patients, with other clinicians, with media people, and so forth, it has occurred to me that podiatry is a branch of allopathic medicine. And I think for people to understand why podiatrists take the approach they take, you need to understand what allopathic medicine's ultimate goals are. And I didn't know this coming out of podiatry school. I didn't know that there were various branches of medicine that had different goals, but we've always tried to aspire to have parity with the osteopaths and the orthopedists or the medical doctors, which means that the podiatrist is not trained to prevent. The podiatrist is trained to make the symptom go away. And when you start to understand that's what it really reflects, you understand that if you're going to go to the podiatrist and you want natural care, you're going to have to specifically ask for it. Because in the mind of most podiatrists, if the symptom is gone, even if you got to cut a nerve, take a piece of bone out, if the symptom is gone, that's considered to be wellness. The problem there is, as a surgeon, having done lots of operations and seeing those people go back into the same footwear, come back to see me a decade later with the same problem, it's short-sighted thinking. It doesn't get to the core root of the problem, which is why I tend to partner more with the naturopathic community. One of the principles of their work is to certainly treat the symptom and try to get the patient well, but always to look for the underlying cause. And that's what Dr. Rossi pointed out. And he pointed out that the science in podiatry, and this might stun you, the science on orthotic therapy in podiatry rarely ever controls for the footwear. So it rarely ever looks at the cause of the problem being influenced at all. Instead, we talk about putting an orthotic into the known causative agent and coming out with success. So it's baffling.